Hi, I'm Larry Mike Renda, and welcome to this edition of Excelsior Forum and Profiles. And back with us is Dr. Vaksha, and we're here to answer all the questions from the previous shows that people have been asking us. And the first thing I'd say is thank you so much for coming back to answer all the questions that we've been getting about all the spine and neck surgeries that we've been talking about in the past. And I was really shocked how many people are really getting these neck and spine surgeries. It's becoming quite commonplace. It's not like this, you would meet one person in 100 and have these surgeries. They're becoming quite common, aren't they?
Yeah. Hi, Larry. So it's good to be back here. It's good to have some more questions. And yes, the spine surgeries have become commoner over time. That's more because of people indulging into sporting activities, the more accidents happening. But at the same time, it's more of the recreational activity that we have been indulging into that takes a toll on the body, causes wear and tear of the body, of multiple joints, including the back and the neck too. But not every patient need to go for surgery. They have to be treated in multiple modalities before we come to a point where patient can be treated only with surgery. So it has become commoner also because we have refined on our techniques. We have become more safer. So we are easily more into buying the stuff that surgery can help them rather than deteriorate them. So yes, it has become commoner over time.
Do you also think that because of the aging population, people are staying alive much longer, that's adding more to the surgery?
Exactly, yes. That is also one of the factors. With more aging, there will be more people who will have more problems in their back, in their neck, and other parts of the body. And so they will need more treatment. Some of them will end up into getting surgeries too.
Now, first question from another viewer was that you spoke of spine and neck surgeries, and they wanted to know, is physical therapy a part of that treatment after the surgery?
Physical therapy is a very important part of treatment of any neck and back pain involvement, including the surgery. It is needed before surgery also and after surgery also. A good result after a surgery depends on how good a physical therapy can help you out with.
Now, also, is there a certain length to the physical therapy after surgery?
It depends from patients to patient. It depends from surgery to surgery also. Some patients may need physical therapy only for a short period of time. Some may need it for many months together.
Now, another question from another viewer was that I'm suffering from neck and back pain. Is it just muscle strain, or when is it time for me to be worried?
So most of the time when you have a neck or back pain, it's mostly because of muscle problem, muscle being weak, muscle fibers being torn partially usually. And most of these patients can be treated with anti-inflammatory medications, some physical therapy, heat packs, ice packs. But it's when the pain is not getting any better over time. It's when it's interfering with daily activities. If it is involved, it is associated with pain going down their leg or arms, causing tingling, causing numbness, causing any weakness, causing problem with their bowel or bladder, causing problem with their mobility, hand movement, walking. It's a time when they have to be worried about it a little bit. Go and see a doctor, understand what's going on. They will try to find out, do the examination, do x-rays, possibly MRI, CT scan to find out what's going on there.
Our next question from a viewer was, is there any way that I can prevent these back and neck injuries from catching up to me in old age or at my current age?
Yeah, exactly. There are ways how to prevent any injuries happening, any degeneration that happens, that's called arthritis of your back, your neck. And that usually involves keeping yourself fit. Physical therapy by itself, going to gym, doing exercises, keeping your muscles strong, doing stretching exercises, keeping your weight under control. All these things help in keeping the body fit, keeping yourself away from injuries, pain in the back, in the neck.
Really? So basically, don't overdo it. That's the...
Yes. Now to define overdo is difficult, but I think life is meant to be active and it should be kept active. You should do exercises, keep yourself strong.
Our next question was from a younger viewer who said that both of his parents and his grandparents have suffered from neck problems. Will he also be suffering from neck problems?
So arthritis, which is the most common form of involvement of back and neck, has a genetic predisposition. People who have parents who have had arthritis are at a higher risk of developing arthritis in the same part of the body, the spine, the knees, the hip, and the hands too. But again, as we discussed, keeping yourself fit, controlling your weight, doing regular exercises do help in delaying or manifesting of these problems.
And also, they're finding out now about the diet also, right?
Yeah, nutrition has a lot to play in keeping yourself fit. Not only controlling your weight, but also the vitamins, the minerals help the body, help the muscles to be in good shape.
An older viewer wrote into us, and she is about to have a surgery. And she wanted to know what materials are going to be used in her surgery. I believe it's going to be some type of fusion. And she's does not know if it's going to be plastic, metal, or actually her own bone that they're going to be using. Could you answer that question for us?
Yeah, so many of the surgeries are surgeries that do not involve implantation of any material. In that, we just clean up the nerve roots, clean up the bone, make the good environment for the bone, and that's it. But when we need to do some fusion surgeries, then we need to put implants in it. Usually the implants are made up out of titanium, sometimes of stainless steel. We also use some polymers like PEEK to make cages when we put inside. We also sometimes use growth factors like BMP, or we can use artificial bone, cadaveric bone also to promote healing. So there are a variety of things that we use. All these things are surgical grade things. They have been tested, researched, and they are safe to be used.
Another question from another viewer was that she believes that if you have one neck or back surgery that you're going to need others in the future. Is that true?
So first of all, the need for one back or neck surgery, it's not straightforward. We try not to do a surgery unless the patient is at a point where there is nothing else that can help them. And the reason behind it is that the surgery is sort of an irreversible phenomena. The process of aging, degeneration, which led to this surgery is still continuing. We are not able to stop or prevent it. So that really causes further degeneration of other levels too. At the same time, the surgery itself predisposes a little bit to further surgeries, also further degeneration, I would say. And these degenerations don't necessarily culminate into a surgery. These patients can again be treated by physical therapy, by medications, by exercise. It's only when these things don't help that we are at a point when we need surgery, then we have to do it.
Right. So in other words, if you operated on the third lower lumbar, okay, and then 6 months to a year later, the person's having a neck problem, it's a total different ballgame, right?
They are totally different places, and they are usually caused because of just aging, the biomechanics of the body. It's only the adjacent segments. If I have done a surgery on suppose L4, L5, then there is a risk of L3, 4 or L5, S1 to degenerate over time just because of the surgery, also contributing to the normal natural progression of the arthritis or the disease at that level.
But then again, these people now, after the surgery, are going to have better mobility. They'll be able to move where they couldn't, and it'll clear up a lot of the other symptoms that you were talking about, correct?
Yes, that's why we are planning to do a surgery so as to make them more active. They can involve more exercises. They can do exercises, keep themselves fit, prevent themselves from getting further problems.
And this bone degeneration that we speak about, like with natural occurring arthritis and stuff like that, having arthritis in your back does not mean that you don't have arthritis in your joints, your elbows, your hands, your fingers. It's all over the body, correct?
Yes. So many of the patients have arthritis all over the body. It's an aging process which involves every joint of the body, including the back and the neck. How fast it goes depends on person to person, including the genetic predisposition, including the injuries they may have got in the past life, also including how fit they are.
Now, one of the viewers was very shocked that you had spoke about actually doing neck surgery from the front. And they wanted to know, how is it actually possible to operate on a neck from the front of the throat? They're saying you have all your veins and everything else like that, major arteries, and stuff. Could you explain a little bit to them how this would work?
Yeah, the front of the neck has really many vital structures. The food pipe, the windpipe, the major arteries going on to the brain. There are big vessels out there. But we have found a way in which we go in between these planes. Rather, the surgeries that are done from the front of the neck on the neck cervical spine are one of the surgeries of spine which have the least blood loss in it. And they are done really good. They have really good results. And it's efficient, it's good. We go in between the levels, in between the planes, go onto the bone, clean the bone. We work with specific instruments which allow us safety of the windpipe, of the food pipe, of the vessels, and we can work very safely there.
Now, we hear a lot about cyberknife and lasers and stuff like that, and very high tech as it's going. Do you use some of these instruments in the neck surgeries?
Yes, we do use some of the advanced instrumentations in our back and neck surgeries. First of all, we use operating microscope to magnify our vision. We work through that. Then we use specific instruments. We use fiber optic lights. We may use ultrasonic blades to cut through the bone to get to the spinal cord or the nerve roots to clean up. And these all things we use. We are looking forward at laser also. It's still in research. We have not yet got results which are substantiated to find out that they can help us in severe conditions.
But that may be a work in progress
yes,
in the future,
that is,
right?
Definitely.
The next question from a viewer was that she's going to have spine neck surgery, and she wants to know, does she have to wear a drain after neck surgery?
It's occasionally that we do put a drain after neck surgery and also after back surgeries too. These drains usually come out when they are in the hospital itself. Sometimes 1 day, sometimes 3 days, and when at the time of the discharge, these drains are already out of their body and they have a sealed wound by that time.
Now, this next question to me should be self-explanatory, but I'm still going to ask it. What do you do if you're supposed to have a surgery and you're avoiding the surgery? What's going to happen to you?
So the surgeries are required because you have failed other mode of treatments. Most of the times. In that case, if you still don't want to have a surgery, you will continue with having pain, the disability that is there, and most of the times you will just continue with that. Rarely you may deteriorate on it also, which may involve deterioration of your nerves or the spinal cord, leading to further pain, tingling, numbness, weakness, involvement of bowel, bladder, gait problems, hand problems. Those are grave problems which once happen may not be recovered from. So many of the times we would like to do surgeries before these things happen, and so as to prevent these from happening.
Because you might get irreversible damage.
Irreversible damage.
And as you had said before, once a nerve is cut, that's pretty much it.
Yes. So that's the same with if the nerve is badly compressed, removing the pressure on it doesn't guarantee that it will recover completely.
Yeah. And a lot of people don't realize, and they're so afraid. But as we had said at the beginning of the program, these surgeries are becoming more and more common. It's less of a danger as it was going back 30, 40 years ago. I mean, the advances that have been made have been, fantastic.
Yeah, we have advanced. We, apart from what we discussed, we also use intraoperative CT scan, intraoperative X-rays, in which we take images, pictures, even CT scan inside the operating room to see that what we are doing is doing the right thing, whether the screws are going in the right trajectory, and we are not missing on it.
The next question from another viewer is, what non-surgical things can I do for my neck and back pain? I know you touched on it a little bit before. Would it be just physical therapy, or would it be maybe something else?
There are some medications also which we try to use, which help in decreasing the pain over time. Most of the times the body can take care of the things, only we have to tide over a period when the pain is worse, when the tingling and numbness is there, and using these medications help us tide over it. It's only when these medications, when the physical therapy, the rest, everything that we have used to treat these symptoms are not working, that we discuss regarding getting a surgical treatment done.
Now, this other viewer also wanted to know the use of these TENS units, I believe, which send electronic impulses to the nerves and stuff. Is it wise to use those prior to a surgery?
Yeah, they can be used definitely prior to surgery and also after the surgery if there is muscle pain in the back essentially. And these help in controlling the pain and help giving mobility to the patient too.
Now, we had a 50-year-old man who asked the question that he's going in for spinal surgery, and he wanted to know, how long will this surgery actually take?
So the duration of surgery varies from region to region, from the level of surgery to be done and the type of surgery to be done. It can vary from 1.5 hours to maybe 6 to 8 hours, sometimes 10 hours, depending on the complexity of the surgeries, on the levels.
And what other like preparation is there before the surgery? It's like, same as everything else, no food, no drink.
Yeah, so before the surgery, we have to first of all see that the patient is fit for the surgery. They are usually seen by the primary care doctor, and there is a pre-anesthetic checkup which is being done. They usually undergo a good blood work, chest x-ray, EKG, to see everything is in place. If they have any pre-existing comorbidity, we have to see that it is optimized, like diabetes, hypertension, so that we don't have the risk from that. Patient have to have good hemoglobin. They are usually brought to the hospital in the morning. They usually don't eat or drink anything for the last 6 to 8 hours, and then there are further preparations that are done in the operating room itself. They are given antibiotics for prevention of infection. If the surgery is long, we do catheterize these patients so as to get their bladder drained during the surgery. The anesthesiologist take control of the patient's blood pressure and other hemodynamics so that body is in good shape while the surgery is being done.
Which brings me to the same viewer had a part two of his question was, does he need to donate his own blood prior to a neck or spine surgery?
The surgeries done from the front of the neck usually don't involve much blood loss, and we usually don't do any blood transfusions in those surgeries. Patients who undergo surgeries from the back on the neck, and most of the time on the lumbar spine or on the lower back, they may need blood transfusions if it is a big surgery, complex surgery, including fusion, more than 2 or 3 levels. These patients can be prepared in advance by using auto transfusions by donating blood. Or we can use, we also sometimes use a cell saver in which we suck the blood which is being lost at the time of surgery. We spin that blood, clean that blood, and give that blood back to the patient.
Now, also, another viewer question, and again, a lot of worried people. They wanted to know, what's basically the success rate of neck and back surgeries compared to, let's say, 30, 40 years ago?
Oh, success rates have increased tremendously, and we have good techniques, good instrumentations to owe that to. The patients who undergo neck surgeries have a very good, more than 95% success rate. Those who undergo back surgeries also have a good, more than 90% success rates, depending on surgery to surgery. Some surgeries have a real great success rates like discectomies and laminectomies, and the one with fusions also give good results.
Now, another viewer question was, this person is actually having spinal surgery also, and they wanted to know, what is like the recovery time? Am I going to have to wear a brace after the surgery on my neck or back? And if so, for how long would I be immobile after the surgery? So 2-in-1 questions there.
Yes, so most of these surgeries, after they are done, patients are allowed to be out of bed very next day or even the same evening. Depending on, again, the type of surgery, they may have to wear a brace on the neck or the back, but they are temporary, more for comfort, more for healing of the soft tissue. They are allowed almost all mobility that they can do under tolerance for the pain, and they are allowed to be mobile, to be active. But it will take some time for them to come back to the level of activity that they were doing before this problem started, before we went into surgery.
Right. Yeah. You can't think that you're going to have the surgery and just jump off the table and start dancing or doing something like that. As usual, like you had said, it's going to be physical therapy, and you're going to ease gently into this. You don't want to like rip or tear up everything that's just been sewn up or fixed up. And the other question that we had from another viewer was not so much about having to wear a brace, but the recovery time. How soon would you be up and walking, you think, after? You're not going to be totally incapacitated.
No, again, as patients are allowed to walk even the same day or the next day, we try to make them active on their feet. Regarding surgical recovery time, if there is a surgery in which we have not done a fusion, usually on the lower back, patients are almost good to be as they were before surgery in about 6 to 8 weeks. Those who have undergone fusion usually takes about 3 months to heal, but they are active and they can be back into their work in about 3 to 4 months.
And here's a really big one, and I was asked by a lot of people about this one, is that after I have this surgery, my neck or back surgery, how soon after this can I bathe? Do I have to take sponge baths? Can I take a shower? Usually, what's the time limit on that?
Yeah, usually we allow the patients to take a shower after about 3 days. They can change the dressing. They have to keep their dressing dry. They are not allowed to bathe for about 3 weeks, 2 to 3 weeks, because the water can cause a problem in the wound. But once the wound is healed, they can do that too. We also don't allow them to go to beaches or go into the seawater for about 3 to 4 weeks.
Yeah, so no pools or spas afterwards, right?
Yes.
The next question had to do with, again, recovery with spinal surgery. Will I need crutches to walk? Will I need a walker to walk? Or is it recommended I try to do this on my own?
So unless the patient has some neurological deficit beforehand, usually they don't need a walker. Sometimes patients who undergo lower back surgeries, which are complex surgeries, sometimes fusion of more than 1 or 2 levels, they may need walker for a few days to help them walk around in their house. Otherwise, most of the patients, especially with the neck surgeries, who have no neurological deficit before the surgery, don't need any walking aid.
Now, the next question from a viewer, and this, again, we deal with a lot of fear here, so that's why we're hoping to shed knowledge and light on this, is that if I have the neck or back surgery, what happens if they find something else wrong? A lot of people have asked that question. Does this an often happen to you? Is it a common occurrence, or is it very rare that when you're operating on something, you find something else?
So before we go into these surgeries, we have already investigated the patient, especially doing X-rays, MRI, and if needed, CT scans. So we have looked at things thoroughly as to what is going on and what we plan to do. It's highly unusual to find anything out of the blue in the surgery, which we may not have contemplated. Sometimes there are things which we think that if this is found, we will do this, but we know it beforehand. It's rare to find something that may be there which we don't know. Now, occasionally, because we work very near to the spinal cord and the dura, which is around the spinal cord and the nerve roots, and it has CSF in it, we may injure the linings, and the CSF may flow out. This can happen, which is again a part of the surgery itself. If this happens, we usually sew it back, seal it back, and then the patient is almost as good as it was without a leak, which is called dural leak.
Now, is that why they require drains or something?
No,
or
unusual to put a drain. Now, very rarely these patients may have leaks which are not resolved after even sealing. Then rarely do we need some drains to be put.
Now, the next question has to do, which is probably, we say the best for last, is that you have a patient, they need surgery in the back or neck. They're terrified. How do you handle that situation?
Very tricky situation. We have to respect patients' view, patients' opinion. We have to give them options. We tell them how things are. We tell them the natural history of the disease, how this will go, how it looks like, how the patient has been doing in the last few weeks or months, and that helps to understand what they will do in the future. It's a patient's choice. They want to get rid of things. They want to get a better quality of life, and if the surgery can really help them. And the options, the risks, the benefits, the complications are discussed with the patient in full, and they have to make an informed choice. Sometimes they may need a second opinion, which we respect, and we can send them to a surgeon whom they want to go, or we can definitely advise them sometimes to go to some other surgeon who can give their professional opinion, understanding what's going on.
And you also warn them of the progressiveness of the disease if they don't get the surgery, correct?
Yes, so that's what they have to understand, that if the surgery is not done, there are chances that they may deteriorate. If the deterioration happens, then if the surgery is done, there's no guarantee that the deterioration will recover, because the nerves can be injured to a point when they will not recover. Even you do whatever, you remove all the compression from the nerve, you do all the fusion surgeries, then also we may end up in not getting a recovery.
Right, and then also leading to worse problems and worse symptoms. Like you were saying, if the nerve is cut or severely damaged, it's not reached in time, then you could have a whole list of problems, like you were saying before: bladder, control, everything, nerves, hands, arms, our whole nervous system is, it's all the electronic grid. So if it goes down, we got problems.
Yeah, again, these patients are very uncommon that who have such severe compression. But if they are, we try to inform them about the urgency of intervention. Most of the patients are not in that position, so we treat them conservatively with all the treatment protocols that we have, medications, physical therapy, and see how they do. If they recover from there, that's good. If they don't, then we discuss the options.
And the other thing too about the spinal surgeries and everything is that you now have all the tools where you can actually show the people, this is your MRI, you see this here, this is the problem, here's your x-ray, this is this problem, here's your CT scan. So it's not like they don't know what's happening with these tools that you have.
Exactly, and also the MRI is read by us as well as the radiologist, and we correlate with each other onto what the findings are. If there is any discrepancy, we do talk to each other to find out what's the exact thing going on, and we can inform the patient. Patient makes an informed decision there.
Well, I wanted to thank you for coming on and answering so many questions, and hopefully the people who are tuning in and watching this and all their questions will be answered. I just had one final question for you is, where do you see the future of neck and spine surgery? Do you see like robots doing it? Is this something like Terminator? Do you see this laser thing that we talked about progressing? Just a final wrap up.
Yeah, so we have come a long way from what we were doing initially. We are trying to do surgeries from small incisions, what's called a minimal invasive surgery. We use intraoperative monitoring. We use electric monitoring to see that we are not injuring the nerves. We use intraoperative x-rays. We use intraoperative CT scans when needed. Also robots, we are using robots now in patients who are tricky, who have complex problems. We use robots in which there is a software which takes into account the anatomy of the patient. They decide from there, we control them, and we put the screws or do the decompression according to the landmarks that have been decided on a software. These again have been tested a number of times into clinical settings and have found to be accurate and safe far more than what we think the other things can be.
So that's great. So there is a really sharp future ahead for neck and back surgeries. Well, I did want to thank you so much for coming back on and answering our viewer questions, because we sure did have a lot of them.
It was a pleasure being here.
And hopefully maybe in the future we get you back again and talk a little bit more about neck and spine.
Yes, sure.
Okay. Until next time, I'm Larry Mike Render for Excelsior Forum and Profiles. Take care and stay healthy. Have a good day.
I'm Vedant Vaksha. I work with Complete Orthopedics. We have offices in Stony Brook, in Little Neck, and in Babylon, and I can be reached through our website, cortho.org, or through our phone number, 631-981-2663.